A really warm welcome to our Eating, Drinking and Swallowing e-learning awareness resource. This session has been developed and delivered by the Community Learning Disability team and Diabetes Nutrition Service at Sirona Care and Health.
We advise completing the online dysphagia guide provided by Health Education England before you continue with this resource. The resource that follows is designed to complement the HEE dysphagia guide, and the package aims to build on the knowledge you have acquired from this learning.
Today we will be discussing the swallowing process, how to support people with their eating and drinking, different signs of difficulty, different food and fluid consistencies as outlined by the International Dysphagia Diet Standardization Initiative, which is also known as IDSI, and we will also be discussing oral care. Now we've got a practical activity slide. So we'd like you to simply have a drink and focus on what's happening when you drink. Some things to really focus in on are what's happening with your lips, your tongue, and when you actually swallow. Can you imagine if you had weakness in the lips, your tongue? How would this impact on your drinking? Notice how quickly drinking happens, how quickly the fluid moves through the mouth. Can you notice the difference between taking small sips or continuous drinking? Does temperature have an impact if you're having a hot drink or a cool drink? Think about the comfort that you receive on a daily basis from drinking and what it would be like if you had difficulties with your drinking.
Now we'd like you to have something to eat. Just a couple of bites of something solid to see what happens when you chew and swallow. Focus on what happens when you bite and when you chew. What are your lips doing? What is your tongue doing? What about your teeth? Think about how saliva gets mixed with the food to make it moist, and how the tongue forms it into a ball-like shape that we call a bolus. Notice how the food gets placed onto the middle of the tongue just before swallowing. Think about what might happen if you had difficulty with your lips or tongue, or if you had no teeth. How would this make it more difficult? You may have worked with service users who lose food out of the front of their mouth due to lip weakness, or have difficulty chewing due to tongue weakness or lack of teeth. Now we are going to cover some of the main structures used for swallowing and how a normal swallow works. This diagram shows a side view of the head and neck. You can see how large the tongue actually is. It has numerous muscles that are used both for helping to move the food around the mouth when chewing and also to push the food or drink to the back of the throat when we swallow. At the back of the mouth is the soft palate, also known as the velum. This moves up when we swallow to close off the entrance to the nasal cavity and prevent food or drink going up into the nose. In the throat, the air pipe is at the front. This is also known as the trachea. At rest, when we're not swallowing, the air pipe is open, allowing us to breathe. At the back is the food pipe, also known as the esophagus, which is closed when we are not swallowing. The section of our throat between the back of the mouth and the entrance to the food pipe is called the pharynx. You can see the epiglottis in the throat. This is a leaf-like structure that points upwards when we are not swallowing and flips down to cover the top of the airway during the swallow. This helps to prevent food or drink from going into the airway. When we swallow, the vocal cords at the top of the air pipe also close to help stop food or drink going the wrong way into the air pipe. The mouth stage of the swallow is under our voluntary control, but as soon as it enters the throat, it becomes a reflex, which we do not have any voluntary control over. The swallow requires very complex coordination of structures and muscles. Even for people without swallowing difficulties, 100% swallow coordination is not always achieved, which can result in food or drink entering the top of the airway and making us cough or choke. Coughing helps the food or drink to be ejected from the air pipe.
The word dysphagia refers to any difficulties with swallowing. This can happen at any stage of the swallow. Difficulties can happen in the mouth, which could include difficulties with your lips sealing, difficulties with your chewing, difficulties controlling food or fluid within the mouth. You can have difficulties in the pharynx or the throat. Difficulties at this stage can lead to aspiration or choking. We will discuss aspiration and choking in a bit more detail later. You can also have difficulties at the level of the esophagus, also known as the food pipe. Difficulties with the esophageal stage are usually managed by a medical team that specialise in gastroenterology.
This video shows a video X-ray of a normal swallow. It is called a video fluoroscopy. Sometimes we refer people for this investigation to see exactly what happens to the food and drink when they swallow. In this clip, the food will be visible as a dark mass. The main reason for showing this is to illustrate just how fast the normal swallow process is.
Let's talk about choking and aspiration. Choking refers to food particles or other foreign objects becoming lodged in the throat and blocking the airway. This is very frightening when it happens, and it can be very frightening to observe. In a true choking episode, the person will be unable to breathe, and therefore this can be life-threatening. Make sure you and your colleagues keep up to date with basic life-saving skills so you are able to handle choking episodes when they occur. Aspiration refers to smaller particles of food or fluid entering the airway and then the lungs. When this happens, we usually see people coughing during or after eating and drinking. However, this is not the only sign of aspiration, and it's worth noting that sometimes people cough during eating and drinking, and it's not related to aspiration. When aspiration happens frequently, the buildup of foreign material in the lungs can lead to chest infections. Serious chest infections, particularly recurring chest infections, may be life-threatening. In some cases, people will be at risk of aspiration, however, they will not be coughing. This can be due to reduced sensation in the throat. We call this silent aspiration, and it is more difficult to identify. It can only be confirmed by having an X-ray of the swallow.
Here we have listed some of the main signs of a swallowing difficulty. We have just covered coughing and choking, and these are often the most obvious signs of a problem. Eye watering, a wet gurgly voice, a change in colour in the face, such as going red, and shortness of breath can also be caused by aspiration. Shortness of breath can also sometimes occur when someone has a respiratory condition such as asthma or COPD, and the need to momentarily stop their breathing to swallow can make them more breathless. Repeated chest infections could be caused by food or drink that has entered the lungs, and this is one of the main health risks of aspiration. Other consequences of a swallowing difficulty include weight loss, malnutrition and dehydration, distress, and reduced quality of life.
In the next section of this resource, we will be discussing some of the strategies that we can employ to help people with difficulties with eating and drinking. This will be split into the following categories: diet modification, adapting the environment, levels of supported feeding, optimizing posture, and oral care.
Now we are going to briefly cover information about the food and fluid descriptors that we often use when making recommendations on guidelines. These are known as IDSI. The Health Education England online training has information about the IDSI framework, so here we will just highlight how the new levels correspond to the old descriptors. At the top, Level 7 regular and easy to chew foods are how we used to describe a normal or soft diet. Level 6, soft and bite-sized, corresponds to the previous Texture E diet, known as fork mashable. Level 5, now known as minced and moist, used to be called Texture D, pre-mashed food. Level 4, pureed, used to be called Texture C, thick puree. In terms of fluids, Level 4, extremely thick fluids, are at the same level as the pureed food, as they are the same consistency. The old descriptors referred to extremely thick fluids as Stage 3. Level 3, moderately thick fluid, corresponds to the previous Stage 2 fluids. This is the same consistency as liquidized food, and as you can see, it is therefore the same level on the diagram, Level 3. We rarely recommend Level 3 food, as the high water content makes it very difficult to contain sufficient calories and nutrients. The new Level 2, mildly thick fluids, correspond to the previous Stage 1 fluids, and Level 1 now corresponds to what we used to call naturally thick fluids. Level 0 is just normal thin fluids, which is how we used to describe them on the old descriptors. For more information, please refer to the IDSI advice leaflet that was sent out with the details of this training.
One of the things that we can do to help people with eating and drinking difficulties is to make sure that we are keeping their mouth as clean as possible by providing frequent oral care, as this is one of the things that we can do to help reduce the risk of chest infection. We recommend taking some time to look at the 2 oral care videos that were sent in the email that accompanied this presentation.
Now we are going to talk about the importance of environment when supporting people with eating and drinking difficulties. It is important to consider each person's needs individually, as what helps one person may be unhelpful for someone else. If the person has eating and drinking guidelines from speech and language therapy, these may provide information about what helps in terms of their mealtime environment. If the service user finds it difficult to communicate their wishes, the person's care plan and other documentation, such as a communication passport, should provide helpful information. Some people can be easily distracted by noise or a busy dining environment, which can make it harder for them to eat and drink safely. Other people can benefit from some quiet background music, for example, to help them tune out more distracting stimuli. Some people eat better when they are alone or with just one member of staff. Others like the social aspect of mealtimes, and this can help them to maximise their food and drink intake. Some homes have a protected mealtimes policy, which, for example, may limit visiting or appointments at this time to ensure people can have a quiet space and sufficient time to eat their meal. If a person is easily visually distracted, it can help to have a clear table with no clutter, or to position the person so they are not facing the area of the room with the most activity, such as the door or the kitchen hatch. Graded support means increasing or decreasing the support you give to a service user to eat or drink, depending on their needs at that specific moment. We strongly promote service users to be as independent as possible with eating and drinking. It is vital that people have as much control as possible over how they eat and drink, both for their independence and dignity, but also because it actually makes their swallow safer. There are studies that show that dependence on others to eat and drink is a major risk factor in developing aspiration-related chest infections. This is because the better able we are to anticipate and control how the food or drink enters our mouths, the easier it is to coordinate the mechanism of eating, drinking, and swallowing. When thinking about the support that a service user needs, always start with the minimal amount of support required. If someone has the correct equipment, such as specialist cutlery, this can help them to be as independent as possible. If you feel that you need more advice about eating or drinking equipment for a particular service user, please get in touch with the CLDT, as a speech and language therapist or occupational therapist may be able to help. A service user may be able to hold the utensil, but may need help to load the food onto it. They may need you to gently hold their hand and help them guide the utensil or the cup to their mouth. If they are unable to grip a utensil or cup at all, or if they are unable to move it to their mouth, then you may need to fully support them. Some service users have variable skills, and you may need to step the support up and down throughout a meal or a drink. The golden rule is to provide the minimum amount of support that they need for each sip or mouthful in order to eat and drink safely and successfully. Somebody's speech and language eating and drinking guidelines should provide more information about the amount of support that the service user requires to eat and drink safely. This is a list of some of the equipment that may benefit service users when eating and drinking. If they have glasses, it is really important that these are offered to the person before meal times, to ensure that they can see the food and equipment and can be as independent as possible throughout the meal. Some service users may benefit from large-handled utensils if they have difficulties with their grip. There is a variety of specialist cutlery that may suit different people, such as weighted cutlery to reduce the impact of tremors, or angled cutlery if the person has difficulty with their arm or hand movements. Non-slip mats can be really helpful in preventing the plate from moving. Lipped plates or plate guards can be used when someone has difficulty using two utensils at the same time and prevents the food from being pushed off the plate when it's being loaded onto the fork or spoon. Warming plates contain a reservoir beneath them which is filled with hot water. This keeps the food warm and can be especially beneficial for people who take a long time to eat. In terms of drinking, there are a range of specialist cups that can help the person to maintain an adequate grip and control the cup as they move it to their mouth. Spouted cups can help reduce spillage from the front of the mouth. However, sometimes this can increase the risk of the fluid being aspirated, as it directs the fluid further back in the mouth and can reduce the person's ability to control it before they trigger a swallow. Again, if you need advice about this, please contact the CLDT. There are also specialist cups that can make the swallow safer. For example, the ProVail cup reduces the amount that can be taken on each sip. Any cups aimed at making the swallow safer would always be assessed by a speech and language therapist before being recommended.
Let's talk about when you should make a referral to speech and language therapy for advice on eating and drinking. We recommend looking back at the slide titled Warning Signs. If you notice any of these things starting to happen and the person does not have speech and language therapy guidelines in place, it's a good idea to make a referral. If they previously have been seen by a speech and language therapist and they've got eating and drinking guidelines, but for whatever reason, these guidelines are deemed to no longer be appropriate and there has been changes to how the person eats and drinks, then it's probably a good idea to make a re-referral. You can use our advice line to ask questions about whether a referral is appropriate, and in some cases, we can provide you with interim advice on how to manage the difficulty. This depends on what the query is. You can complete a referral form from the link in this slide and return it to our referral email inbox. Thank you very much for listening and for taking the time out of your day to go through these slides. Please don't hesitate to get in contact with us if you have any questions. If we have enough demand, we may arrange a supplementary Q&A session to address specific concerns. So please get in touch and let us know if this is something you would be interested in. We look forward to hearing from you. Thank you very much.